Okay, good afternoon, everybody. This is Dr. Dady from the Center for Health and Healing. And today I have with me Alex LaPierre, and she specializes in myofascial release, but a very specific technique. So we thought it would be really great to talk about the little slang names that people call massage or chiropractic. I tell patients I'm not a rack and cracker, and I would say for her, she's not a buff and fluffer. So today we're going to really explain to you what to look for when you're looking for a good massage therapist and a good chiropractor. So I'm going to turn it over to Alex and let her fill you in. And so Alex, tell me, how long have you been doing massage and how did you get into this technique?
Sure. Well, thanks for having me on the podcast today. It's an honor to be here with you and speak to whomever has a chance to hear our success stories and what we have to offer. So how long have I been a massage therapist? I started my massage therapy journey professionally in 2018. I was working on horses, and as I worked on horses, the owners would bring me their animals holding their back with one arm and their animal with the other arm, begging me to work on them. So I said, that's fine. I'm happy to work with people. I love people. And went back to massage school in 2019, but I found the modality that I specialize in, that's John F. Barnes' Myofascial Release, actually trying to heal my own pain and challenges with my body. And what I noticed at the time, and this was in 2018, at the end of the year, I was in traditional physical therapy, receiving treatment for low back pain, and I was progressively getting stronger, but my system was tightening down, and I was developing new symptoms that seemed unrelated. The physical therapist I worked with used myofascial cupping, and while the initial treatment was a bit of a shock to my system, the relief I got was incredible. And I looked at her and I said, I need this over my entire body. And she said, well, I'm under insurance and I can only look at one area of your body. So I found a John F. Barnes trained myofascial release massage therapist, went in for a few sessions and almost floated off the table. And I felt my body getting stronger as my system was decompressed. And that just absolutely blew my mind. I said, this is what I want to do with the rest of my life. And that was a huge moment for me.
Right. I mean, as a chiropractor, I've been practicing 30 years, and people ask me, how did you get into chiropractic? I'm like, well, I was an athlete. I was a track athlete, and then I got into bodybuilding. And I was in the gym one day doing leg presses and hurt my back. I went to a chiropractor, and I was always intrigued after that, but I loved Atlanta, and when I graduated, I just moved here and didn't know anyone, and met people that went to Life College. And that's really why I went to Life College. I met them, and they're like, oh, you love Life College because you're an athlete, you've had these injuries, and so I talked to them a little bit about my experiences. But I was thinking about what you just said, though. I mean, I know what it's like to break up scar tissue with patients. You know, talking about the strength you must have to have in your hands to work on big animals, right? Horses. So I would say that you went into this with some really strong, being able to really do a great massage if you work first on horses. There's some chiropractors that do equine adjusting, and like they use 2x4s and something like, oh my gosh, that just seems like it's kind of backbreaking. How they adjust with that, that's what they do. I've seen some adjustments that are a little, takes you back a little bit. So go on and describe what it is that, you know, I call it a fluff and buff because sometimes people just want to lay on the table and feel good. It's not really therapy. You do therapy, but what really intrigued me when we first met was the emotional release to therapy, because I've gone to trauma therapy where I see a therapist, EMDR, but when you talk about muscle release, because a lot of muscle imbalances, even for myself, I have a torn pec, no disc in L5, and being an athlete, I beat myself up pretty good. But the communication in these muscles gets confusing, muscle confusion. And I would think what you do, when you told me what you did, that would really be helpful for me. That's why that I wanted to come see you, is to see if you could release those muscles because they're being held by some emotional connection, because everything's so emotional, right? I tell patients, I can do all this for you, but understand that you can your brain is the biggest organ, and so you can get better because you're more positive, or you can be sicker because you're more negative. So I would say that your myofascial release, the specific technique you do, would help with, I say chiropractic and massage is a marriage, because if you're a chiropractor, that's why I call it rack and crack. And I try to explain, I have a couple of videos out there, like, okay, when you're looking for a chiropractor, you don't want to be the 50 people waiting in the waiting room and the 2 minutes on the table, because that's an aspirin. So you want to make sure they take a full set of x-rays, they do a full exam, they explain the x-rays. They also have in your intake form, you want to know each organ and gland system that you're dealing with. And then they have a plan, a care plan to correct the dysfunction. That is stretching exercises. I do cupping, gua sha, all this traction. But the main thing that makes the biggest difference for me is I use things called posture pump. Because if you come in, you've lost your curve, you're sitting at the desk all day, if I can't get that curve back, I'm just racking and cracking you. I do the muscular work, and then I put them on, it's called a posture pump. So if I'm doing the muscle work, breaking up the scar tissue, having the massage therapist do break up the scar tissue, doing traction, having them do stretching at night, and then they use that posture pump, laying on that posture pump 15 minutes, starts undoing bad posture, because posture changes structure. It starts, 15 minutes will undo a whole week of bad posture. Mm-hmm. So I want to restore the curve, which restores the neurological system, the nervous system, which will stop any degenerative joint disease, or it will rehydrate the disc. That's just it in a nutshell. That's what with each patient, that's what I do. But the muscle component is the very biggest thing that I deal with. You have a tight muscle on the right-hand side, an overstretched one on the left, and if you're just sitting there making some noise, cracking and racking and cracking, they leave and they're tight again.
Right.
So doing that muscle work, breaking up that scar tissue,
right,
getting that joint to hold.
Right.
It holds an hour, it holds 2 days, it holds 4 days, then you're holding it, then you give them the tools. That's why that next step, though, is where because now I haven't changed their emotional state of being. That's where that next technique that you're going to talk about, where the emotional side of massage, myofascial release,
sure,
not the buff and fluff, how you change that component and that dysfunction.
So I think as therapeutic professionals, it's important for us to realize that we're facilitators, right? We have lots of tools that we can use for our clients to help them create change in and around their bodies, but it's their work to be done, right? And so they may come in with restrictions, and we can go in with our hands and break it up. But one of the foundational principles of being a John F. Barnes myofascial release therapist is that we incorporate a lot of long holds, right? So we place our hands gently on the system, and then we sink down to the depth barrier, and we wait. We put gentle, gentle, gentle traction into the system, and we wait. And it's that opportunity of allowing the client and their conscious mind and their being and who they are come up into our hands and into that healing space and realize what's going on in that tissue that creates that space for them to feel free enough to express. And that expression we refer to as unwinding. That expression may be a movement of the body. Maybe as we're working along the neck, the nose will begin to turn one way or the other as the body regains a sense of no that maybe it didn't have during a traumatic accident. Mm-hmm. And then the body feels safe to take that nose from left to right, mm-hmm. right? So, if we're talking about what a myofascial release massage therapist can do in specificity and comparison to your traditional fluff and buff relaxation massage therapist, we are more of a facilitator, encouraging that awareness and allowing the client to come into this space of healing and be authentic and be themselves and really feel for themselves into these spaces that have gotten restricted. If we're talking about the pecs, maybe there was a traumatic incident where a person needed to kind of shield themselves, or maybe they pushed through a lot, mm-hmm. and they've overexerted those muscles. And that causes the restriction in the system that locks down the fascia. The fascia is like a sleeve over the muscle. If we're talking about muscles specifically, there are fascial layers all throughout the body. They don't just cover muscle. They cover each muscle fiber, each muscle fascicle. The periosteum is the layer around bones that is fascial in nature.
That's that sarcomere. Sarcomere is what we talk about when contracting, relaxing a muscle, and you're
Right.
saying calcium, magnesium, potassium, what you need to have a contraction in there. You know, when people spasm, they muscle spasms, or they can be dehydrated.
Right.
That muscle then gets locked.
It
in
gets
position.
locked, right.
Yes.
And so we sink into the system and we invite those locked restrictions to open up. It doesn't always include an emotional component, but it may.
Okay.
It
okay.
may. I had my hands on a client the other day, and she's coming to me for tailbone pain. And intuitively, I looked at her posture and I said, something's going on in your neck. Can I work there? We'd already dressed quite a bit around the tailbone. And she said, yeah, I'm open to that. So I cradled the back of her head, and I asked permission to put my hand just on her chest, on her sternum, and offered traction and compression in that direction. And she began to unwind, and that no came up. And as we worked through, she said, gosh, I so appreciate how gentle you are with my neck.
Mm-hmm.
And then she also shared that she had had a strangulation incident with a former spouse.
Oh.
And so some of that memory was resurfacing, but we were allowing the body to recode that level of touch into the system so that now she can be freer in that space.
That makes a lot of sense. So, a story, because I do natural medicine, so I had a patient that lost a child. And, you know, and you can admit to this too, there are patients that come in and you're like, oh, they're coming in today, and you just know they're not very optimistic, and they're always seem kind of like, oh, how are you doing today? And then there's people come in, I'm doing great, this is happening, that's happening. You know, because I tell them, we're changing your demise. Not chiropractically, natural medicine is my other hat. I sent her to do this emotional release.
Good.
And she is totally a different person.
I believe it.
Right? Totally different person. I mean, I actually enjoy when she's coming in now.
Yeah.
And then everything, her thyroid
all changed.
level, everything went back to normal.
Right.
Her gut, yes, because adrenally, there's adrenal glands,
Right.
there's stress glands.
Right.
She's constantly in a depressed state of the loss of the child.
Mm-hmm.
You know, that it so encompasses the body as a whole.
Mm-hmm.
When we're not dartboards.
No.
So when you come in for care, it's like, you have a thyroid problem? Okay, thyroid. No.
Right.
Nothing happens by itself.
Correct.
So the emotional component, the myofascial release, the muscle component.
Correct.
Then, you know, bones being misaligned
Mm-hmm.
is first from the muscular issue.
Yeah.
It's muscles.
Yeah.
So, yeah, bone, move. But if you're not addressing those muscles, no. Then if you're not addressing the emotional component,
Right.
like you're talking about, that's why I love that combination.
Mm-hmm.
Then you don't get the results. I'm all about results. I'm all about getting results.
Yeah.
I mean, you know, being an athlete my whole life, I want to win. I want that patient better, sleeping, not have hormones lined up, whatever the autoimmune, you know, anything that's going on for that patient. Chiropractic, you better be feeling much better first, second, third, fourth visit. We don't just keep seeing you.
Agreed.
Right? Like, if we're not making gains,
We need
there's something.
stress.
Yeah, that's right. And I give them homework. They have to do their stretching. So with your technique,
Mm-hmm.
you say you have tools, and each, you know, you have different tools for patients. So when you're seeing your clients and you're massaging them, you're doing the technique,
Yes.
do you give them things at home when you're finding some emotion? Do you send them on to anyone, like a EMDR thing, like any of that stuff do you do?
Absolutely.
Okay.
So my primary homework tool, I offer every single client that comes to me a 4-inch treatment ball. It's inflatable.
Oh.
And we talk a lot about working gently into the system as opposed to aggressively.
Not a golf ball? Come on.
No golf balls. I don't do golf balls.
That's pretty hard, isn't it?
Yeah, it's a very, very different sensation. And so the way we look at it in the Barnes realm is that if you put too much pressure, too much intention into the system will actually come up and fight.
They muscle block.
Right,
Yeah,
right. So gentle, steady pressure into the system is what creates that lasting change and allows that ground substance to soften. I like to describe the ground substance as solidified peanut butter and a peanut butter sandwich that you put in the fridge, right? So if you were to put that peanut butter sandwich between your hands and squeeze and gently hold you're touching the outer layer of the ground substance, but eventually that peanut butter is going to start to soften, right? And so that's similar to what happens when we work with the fascia in that gentle manner. So that's the primary. I will encourage people to scream in their cars. You know, if I can tell they've got a lot of rage build up in their system that maybe has never been honored, I say, you know what? Nobody can hear you. And even if you're stopped, you know, at a stoplight or something like that, or in a parking lot, would probably be safer. Go park and just allow yourself to absolutely erupt. Because we all need that. We all need that. Every single one of us has been in a meeting or in an altercation, a verbal altercation with someone where we had to hold back and restrain ourselves. And that motion and that lack of ability to safely express gets stuck in our system, and it's all
That's
energy.
What I was going to say. It gets blocked, so you have an experience,
right?
And it gets blocked, so you're not removing that,
right?
And so that's why you'll have, like, I would say I am guilty of this. Someone that tries to be an overachiever, so till you hurt yourself, like training, like the constant drive, right?
Right.
So it takes age. And I got some of that now, but it takes that kind of thing to, you know, put your ego back down and then start really getting deep within, like really searching, right? I think that when you're seeing clients, seeing patients, you really get that connection because you're really trying to change people's lives. So it's not just a one-horse pony show. So it's great to have you to refer to. And I have someone I do EMDR. It really is a collaborative teamwork to really get somebody to that place in their life. So I love having a network of people because I'm not the end-all, do-all, right? So when you told me what you did, I was very intrigued, so I had to get you on here and really explain that. How can people find you, reach out for you to find out about your do massage, get massaged? How do they find you?
Okay. So the name of my business is North Georgia Myofascial Release. My website is North, as in the direction north, GA, as in the abbreviation for Georgia, M as in M&M's, F as in Frank, R as in Riley.com. So that's northgamfr.com.
I like that.
Or, of course, I'm available by text or phone call at 678-262-8843.
I'm going to put you on my website. I'll ask the guy that does my website stuff so I can have, so if someone's on my website and they listen to this podcast, they can just find you. And if you click the link below, you can open up the drdady.com and get on the website and find more about this technique and find more about what it is that we do. So thank you for listening today, and hope you have a wonderful day. Thank you for coming and doing this with me.
Thanks so much.